get so used to wearing this. Good morning. Thanks, as always, to Jay and Vicki for helping us interpret this morning. I'm going to read off the numbers. We do have Greg Casterman here this morning, and so he will elaborate on the numbers. All right, so as of this morning, our COVID positive cases in Hamilton County are at 8,020. Difference between now and last week is 841. The number of those hospitalized is 849. The delta, or the change from last week, is 50. And then the number of deaths in Hamilton County is at 219. The increase from last week is 11. So Greg is going to illuminate a little bit on these numbers and trends, really, because what we're looking for here is trends. And what we are seeing, generally speaking, is that we are still at high levels, but we have plateaued a little bit as a result, we think, of changed behavior in Hamilton County to the positive. So while our numbers are still higher than we want them to be, we have plateaued a little bit, and we are not continuing to increase. We're staying steady, and hopefully we'll soon see a decrease. As we watch the virus spread throughout the county, it's a grim reminder that we are at a crossroads in Hamilton County. We could go the route to Florida and other states, or we could curtail the spread and get cases headed in the right direction. While heading the wrong direction is a frightening prospect, the good news is that our destiny is in our hands because we know what to do. Wash our hands, keep our distance, and wear a mask. I am going to just briefly read part of an email I received. You know, I get a lot of emails related to COVID, related to what's going on in the community, related to what people think we should be doing. Some positive, some negative. This one is from a gentleman from Anderson Township, and as I read through it, he was unhappy about some behaviors that he had seen taking place out in the community, and he reminded me through this email of some of the sacrifices that have been made by people, by all of us throughout the community when it comes to visiting people we love, when it comes to, just our everyday habits, moving around out and about. And so I'm going to read just a small snippet of this just to ground this conversation and to remind us of the struggles and the sacrifices, really, that are being made by everybody in this community. He says, "I have not seen my son in 6 months because of this virus. My daughter is a nurse and often has to work overtime and on her off days. I worry about her exhaustion and her mental health. My friend has not gotten to hold her new grandchild. I have had 2 friends pass away, and their families were not able to have funerals." So I just want to say that thank you to members of this community who continue to make sacrifices for the good of the common good so that we can tamp down the virus. And thank you for this email. It's a reminder of where we are and where we need to go. So we need to redouble our efforts and take simple steps, as we know. So in a minute, we're going to hear from Greg Casterman. He'll provide us with an update and where we stand in Hamilton County. But first, I'd like to make a special announcement. I'm proud to report that the Hamilton County Commission is offering $3.5 million in rent relief to families who have lost income due to COVID-19. The Hamilton County CARES Rent and Utility Relief Program draws on CARES Act funding to provide short-term assistance to renters who live in Hamilton County and can document income loss due to COVID-19 through the pandemic. So many of our neighbors in Hamilton County are struggling right now to pay their rent and utilities due to lost income from COVID-19. This assistance will allow families to stay in their homes and avoid eviction. Under the program, the county will pay up to 3 months' rent and utility payments with a maximum of $2,500 for households at or below 80% of the area median income. To manage and distribute the funds, we have awarded contracts to the Freestore Foodbank, Talbert House, and the Community Action Agency. Together, they aim to help more than 1,200 renting households. In a few minutes, we're going to hear from representatives from those agencies to talk us through the details of the program and share how people can apply for the funds. In a related matter, Duke Energy wants to remind citizens that they can ask for assistance on utility payments, including extended payment arrangements. For more information, visit their website. It's dukeenergyupdates.com. Going to do that again. dukeenergyupdates.com. All right, so we are going to get to them in a minute, but first I would like to have Greg Casterman, the Health Commissioner for Hamilton County, come up and talk us through his update since last week.
Good morning, and thank you, Commissioner Dreihaus, for having me today. I'd like to start off by going through some of the numbers and some of the data as I've been over the last several weeks while we do this press conference. On the first slide is directly from our website. I'd encourage everyone to check out our website, hcph.org. This is updated daily at 2, and it gives you a great opportunity to drill into the data for your zip code so you can learn more about what's happening with regards to cases. Here in the county, you can actually see a bit of a leveling off and even a slight decrease in the last several days, which I think is very positive. I'm very glad to see this. Some of this is certainly tied to testing. The testing over the last week has been slightly diminished, although overall, seeing this drop in cases is one positive indicator. You can also see that we are continuing to test a large number of our younger population. Worth noting, this younger demographic did not have access to testing early in the pandemic, so we would expect to see more people take advantage of this opportunity. This can also explain partly why hospitalizations are not as elevated as they might be. If we were seeing elderly people who are more impacted in the hospital, it would have an impact of greater magnitude. Speaking regarding hospitalizations and intensive care unit admissions, both remain elevated. However, since last week, they have not seen any increase. So as Commissioner Dreihaus indicated, those two metrics have plateaued, which is also very positive. I'd like to discuss briefly also the reproductive value, which I've been discussing over the last several weeks. We here in Hamilton County are at 0.88, which is lower than last week, and also we've been hovering below 1.0 for several weeks now, I believe 4 weeks. This number, as I've shared, if it's above 1.0, it indicates the outbreak is spreading and increasing in the number of people getting sick. If it's below 1.0, it's an indication that things are starting to constrict and not spread as much in the community. While it's just one value, it is a second positive sign that we are making some improvements within our community. We've also been fielding a lot of questions about positivity rates, so I'd like to share a slide that was put together by the Health Collaborative and Cincinnati Children's Hospital Medical Center. In this slide, you can see on the bottom half of the slide, the dark bars are an indication of the number of tests being performed on a daily basis within the region. We've been hovering around in the red box there. We've been hovering anywhere from 1,500 tests all the way up to 4,000 tests over the last several weeks. The positivity rate here for the 14-county region is about 5%. You can see it hops around a little bit, but generally speaking, it's remained fairly consistent. That is also one indicator. It is not a random sample, meaning anyone can go get tested. People who feel sick often are more likely to get tested. So it's not a perfect indicator, but it is another measure that we continue to watch in public health and with our partners. Having said all this, it is really important to focus on a wide array of indicators rather than a single number. For instance, we look closely at case numbers, hospitalizations, intensive care unit admissions, and deaths. And as I've shared so far, things remain fairly flat for this week. I'd like to give some credit to everyone here in Hamilton County. As I've shared in past weeks, when I go out and about and my team is moving through the community, we have seen significant numbers of people within businesses wearing masks. Many of our businesses require it now and actually enforce it. So I think it is our hard work that is slowly starting to make an impact here in Hamilton County. So I'd like to sincerely say thank you for everyone for putting your effort in. It's how we're going to get through this fall. And to that regard, last week when I was sharing an update on the new state's alert system, I was actually anticipating Hamilton County, we were on the verge of going purple. so to the highest alert level. And you can see we actually were downgraded. We are now just a level 3. We are not on the brink of going purple. The indicator in the hard work and the measure that switched had to do with the trajectory of new cases over the last 5-day period. So we were able to flatten that number, actually decrease that number, and we were able to go back to just level 3. As you recall, level 3 or red means we are still high. We see a lot of community spread still, but it also requires mask wearing, which is a tool for helping us get back to yellow or to orange, which I believe that we here in Hamilton County can do. I'd like to touch base on testing. We are continuing to see a lot of test opportunities here in Hamilton County. I am partnering with Hamilton County as well as the National Guard again. We'll begin to do some testing in August. More details of that will be forthcoming as we hammer out the final items so that we can make that successful. We've announced previously that if you do need a test, please check out our website, hcph.org. Lots of opportunities to get testing. Many of them have very quick turnaround times, including 1-day or 2-day turnaround times. Check out the website though, so you show up with what you need and you're able to get tested when you appear at the test site. So in wrapping things up, I want to make sure that I mention that mask wearing in combination with the other prevention steps that we've been talking about have really started to make a difference in my opinion. When you're ill, we're still asking you to stay home even if you've recently had a test for COVID-19. We know that physical distancing, hand washing, and covering our coughs all have an impact. The reason why we keep talking about this is that these are the only tools that we have right now for making a difference with COVID-19. I actually believe as we head into fall and as we start flu season and when we start to see more colds, these are basic infection prevention measures. They will make an impact on those other items as well. So I think we're doing the right thing to help get us into fall and into winter and to keep the curve flat. So we're starting to get it. Most people are starting to wear masks. Most people are wearing masks when they're in stores. And I really just ask as we continue in the coming weeks, we continue to work as a community so that we can get through this. Wear a mask, stay home if you're sick, treat workers around you with respect, and most of all, please be kind. Thank you.
Thank you, Greg. Nice reminder that we should thank everyone for doing your part, for flattening the curve and keeping the community safe. All right, so we're going to hear from the 3 organizations that are helping us roll out the rental assistance program. This is such a big deal for so many people in this community that are really struggling to pay their rent related to loss of revenue and COVID-19. And so today, and I think they're joining us virtually, I hope, that we've got Jimmy Wilson, who is the Vice President of Housing for Talbert House. We've got Kim Mcclendon, who is the Supportive Services Manager at CAA. And from the Freestore Foodbank, I believe Kurt Reiber is on the line. He's the President and CEO of the Freestore Foodbank. And so if you wouldn't mind, those of you that have joined us virtually, I'm going to start with Jimmy Wilson from Talbert to talk about your role in this. And what I think we're hoping for is information related to the program itself, but especially the information where people can apply for this assistance through your agencies and hopefully get that assistance. So Jimmy, we're going to turn it over to you for a couple minutes here.
Good morning. Can everyone hear me? Yes, thank you. I want to begin with thanking the county commissioners and the county staff for selecting Talbert House to participate in this program and to provide this service to the community. We're excited about being able to help households in the community with issues concerning their rent and their utilities. In order for members of the community to contact us, they would call a number. It's 513-338-8596. Again, it's 513-338-8596. That's the number for Talbert House, the 24-hour line where staff will do a brief screening for clients who call in need of assistance, and then a case manager will follow up with that household within 24 hours to schedule an appointment. we're excited about this. We think we'll be able to help a lot of folks. We're anticipating to help about 500 people. And as they meet with Talbot House case managers, if families are in need of additional services, we'll be able to make those linkages as well, managing stress, perhaps issues with substance use, job readiness, employment, or maybe even housing types of challenges. So we have an array of services that we can make available if a household needs additional assistance as they seek relief from this CARES Fund. So again, thank you for the opportunity to serve, and we look forward to being a part of the team to help provide this assistance around the county.
Thank you. Thank you so much for that information. All right, we are going to now go to Kim Mcclendon with the CAA.
Thank you so much. The Community Action, I just want to start off by saying that the Community Action Agency, we've been providing rental and utility assistance for many years, and we are elated to be working alongside Freestore Foodbank and Talbot House to continue serving people in our communities that have been impacted by COVID-19 with new CARES Act money from Hamilton County. So we're extremely appreciative of being selected to disperse these funds. With the moratorium on evictions for renters living in publicly owned housing being lifted this week, and Duke Energy possibly lifting their moratorium sometime in August, additional funds for unemployment benefits set to expire soon. This money came just at the right time. And this fund is going to allow us to not only assist with past due rents, but also water and Duke Energy. And Duke Energy, we do have a program currently at CAA through HEAP that assists with that as well. But this is something different, and I believe it'll touch more lives. We are partnering, the Community Action Agency, we are partnering with several local social service agencies as well as some churches to assist with case management. And that's going to allow us to be able to have more hands on deck to process applications. And that's going to result in a shorter period of time for us to respond to our clients' needs. The names of those agencies will be shared at a later date as we're still working through the details. However, CAA, we are starting to accept applications today, and you can call us at 513-569-1840, option 4. And that number again is 513-569-1840, option 4. And one of the case managers will call you back in 48 hours, within 48 hours. Thank you
so much for that information. And again, I want to emphasize that the program is rolling out today, so you can contact any of the numbers that are given today. So let's turn it over to Kurt Reiber. He's from the Freestore Foodbank.
Thank you, Commissioner Dreihaus, and thank you. Good morning. First of all, the Freestore would love to thank Commissioner Dreihaus, Commissioner Dumas, and Commissioner Parks for this enlightened approach to rental assistance and utility assistance that is making it possible through the CARES Act funding. We can't be more proud to be partnering with our collaborative partners at Talbot House or Community Action Agency. We've had long-standing relationships with them, and they have helped us distribute over 1 million pounds of food each and every week since the shutdown occurred in mid-March. But we know that it's not food alone that families are needing. Right now, they need rental assistance and utility assistance to provide for their stability. And this funding will go a long ways towards meeting that stability that's needed at this time. When you think of the families that have been impacted by business closures, furloughs, and layoffs, this rental assistance comes at an opportune time. And as Commissioner Dreihaus said earlier, $2,500 per family will be able to go out from now and through December 31st of this year. At the Freestore Foodbank, our Director of Public Benefits, Ryan Lucky, will be the person that will be in charge of this operation for the Freestore. He's been with us for a number of years, but has also got a team of professionals behind him. You can call 513-357-4687. That's 513-357-4687 to get assistance, or you can email Ryan directly at rlucky, it's RLUCKIE at freestorefoodbank.org. And Ryan will be able to get, either he or his team members will be able to support you in the assistance that you're looking for. And that's, Ryan is located at our Customer Connection Center in Liberty Street, which is also home to our Liberty Street Market, which is open once again as a choice pantry for families needing assistance for food, as well as other supportive services. So thank you, Commissioner Dreihaus, for this opportunity to showcase this extraordinary work that the Commission is making possible in our community.
Yeah, thank you. And thank you. Neil Tillo has joined as well from Talbot House. So thank you, Neil, for joining the call. So I just want to say that these three organizations, Talbot House, CAA, and Freestore Foodbank, are stalwarts in this community. They have been doing work to help citizens in this community who face different kinds of challenges for many, many years. And so while this was a competitive process in the county, you put out the RFP and there were a number of responses to that RFP, these are the organizations that rose to the top of that process and have a great deal of experience doing this kind of work already. And so we couldn't be more happy to be partnering with all of you through, to do this work. So I'm going to ask you all to stay on the line in case there are questions related to the rental assistance program through the end of the briefing. But I've got one more thing before we go to questions. So today's been a bit of a good news day, I think. Not by design necessarily, but anyway, it is, because we're rolling out this program. We've got a flattening of the curve here in Hamilton County. People are doing their part. We're wearing their masks. We're doing what we need to do. So we're feeling fairly upbeat right now. So I've got one more thing that I want to announce before we head to questions that I think is the most upbeat thing that we have this morning. And we've mentioned this, but as you all know, opening day for the Reds is going to happen on Friday, July 24th. When have we ever had an opening day on July 24th? It will be virtual. There will be no fans in the stands, but you will be able to listen to the game on the radio or watch the game on TV. Hopefully, it'll be a coming together for the community. And so the County Commission has done a resolution, as we often do, for special occasions. And so I'm just going to read a couple of the whereas clauses, because we are proclaiming Friday, Wear Red Day in Hamilton County, whereas nobody does opening day better than Hamilton County. And whereas Hamilton County is the birthplace of the best opening day celebration in all of baseball, and whereas the Great American Ballpark pays tribute to the Reds' rich history as baseball's first professional franchise and includes the Cincinnati Reds Hall of Fame and Museum, and whereas this opening day is the first and hopefully the last virtual opening day, and whereas the Reds are an institution in Hamilton County and in the city of Cincinnati, beloved by all. Now, therefore, be it resolved that the Board of County Commissioners of Hamilton County does encourage everyone in Hamilton County to participate in Wear Red Day, and be it further resolved that the Board of County Commissioners does proclaim July 24th, 2020 as Wear Red Day in all of Hamilton County. So in order to continue to help celebrate, so you all can't see that I am wearing red. I've got a red skirt on. It's about as good as it gets for me. But I do have a ball cap, and I don't want to get selfish wearing all the red, so I'm going to give this to Jay for a moment, because he clearly missed the memo. That's what we're talking about. Wear Red Day. That's right. Go Reds. You don't have to wear it. Yeah, there we go. Okay. It's adjustable, so it fits both of us. So anyway, wear red on Friday. Join the celebration. We've got something to celebrate in Cincinnati and Hamilton County. We're in a difficult time, but man, oh man, we got something fun to celebrate and come together with, and no better organization than the Cincinnati Reds. So go Reds. We hope we have a victory on Friday. All right, so with that, we're going to go to questions. Bridget, help us with those questions.
Yeah, our first question is from Scott Wortman with the Inquirer, and he has questions for you, Greg.
Good morning, Scott.
Scott, unmute on your end, if you could. Hey, Scott. You might want to unmute on your end.
My apologies. Can you hear me?
Yes, sir.
I wanted to make sure I'm getting the numbers correct to illustrate how we've started the plateau. if I heard correctly at the start of the press conference, were there 841 new cases this week compared to last week?
I'm going to let Commissioner Dreihaus share. Those were her Delta numbers, so per week. I was sharing the information from our Epi curve, which is found on our website. So one moment, we'll switch.
When you say that, though, I mean, I guess when you say it's plateaued, like there were like, what are the raw numbers that show the change or lack of change or a decreased change?
Can we put back up the first slide from Hamilton County's website?
Yeah, I saw that, but I just wanted to know what the exact numbers were that I could cite.
So I would have to drill in on our website. The numbers I'm most familiar with are the numbers for just Hamilton County Public Health's jurisdiction outside the city of Cincinnati, Norwood, and Springdale. This slide represents the data for the entire county. If you were to go to our website and put your mouse on each of those bars, it will actually tell you the exact number of cases per day. I would caution that if you want it for the countywide, make sure you first toggle over to the countywide map, and then you can get that data. On average, my team sees anywhere from 70 to 100 new cases per day, and that has been fairly consistent over the last couple weeks.
Okay. All right, and then the other.
Commissioner Dreihaus.
Yeah, Scott, let me elaborate, because the numbers, and the delta, the change from week to week, it's really the increase from week to week. So let me clarify just for a minute. So the 841 is the increase of positive cases in a week's time. And we've been doing this week to week, kind of tracking this so we can see the trend. So 841, it was the difference this time. Last week when we reported this number, it was 1,021. The week before, it was 1,148. The week before, it was 912. And so I've got these data points from every week since we've been doing this. And so I'm happy to share this. But the idea is that it's the trend that we're most concerned about. So when I give you these numbers, they are the difference or the increase from last week to this week. And what we're seeing is a flattening of the curve.
And I had one other question for Greg regarding testing. We had our health reporter had in today's story, in some cases, and it was on your website, that testing results can take as long as 2 weeks to get results. And you had mentioned that sometimes it's usually like 2 days. A lot of people say it even needs to be faster than that in order to get a handle on this. How are you going to address that and get a quicker turnaround?
So I think it is absolutely critical to say that the quickest we can turn around tests, the better off we are, both from a public health perspective. We can quicker respond to a positive case and do contact tracing, as well as making sure that individual stays home and isolates. Anyone with symptoms is being asked at the time of testing to stay home. You're not to go into public if you have any kind of symptoms for COVID-19. That's been the message throughout. To make improvements, we have here in Hamilton County in the region something called multi-agency coordination, which involves all 5 hospital systems here in Hamilton County. It involves public health and nursing homes and a variety of other partners. We have been discussing this, and we are working with them to try and make better opportunities for quicker turnaround time. With the testing that occurred at the pop-up sites that we ran, we were a little bit at the mercy of the Ohio National Guard. My agency did not pick the laboratories in which those results went to. It was actually the National Guard that did. And after week 1, where we did 3,500 tests, we knew that we were overwhelming our laboratories here. By week 2, the National Guard actually started shifting our results to various locations, including the Ohio Department of Health, Ohio State University, as well as Dayton Children's Hospital. So that did help reduce the time, but ultimately our goal remains to have test results within 1 or 2 days so that we can immediately let the patient know, as well as make an impact from from contact tracing.
Our next question comes from Christian Hauser with Local 12. He has some questions on the rent and utility relief program.
Thank you very much. Just 2 quick questions, and I guess either Commissioner Dreihaus or maybe someone with Taubert House or CAA or Foodbank could best answer this. But is is the demand for rental assistance known within the county? I know that right now there are about 1,000 evictions on the docket for the county. So obviously this leaves a little bit extra for those people and some. And then my second question is there a chance for a second round of this rental assistance once this first batch has gone through?
So let me put this in the context of the CARES Act dollars that we're talking about. And we will have a dashboard. I know I've been talking about this dashboard. It's almost there. But this is in the context of the money that we got from the federal government that has to be spent related to COVID-19. And so we set aside $5 million for rental assistance and eviction prevention. So this 3.5 is part of that 5 million. There's a 1.5 set aside for eviction prevention for those that are already in the process of being evicted and are over in court. So we're working with Aptab Pureval, Greg Landsman, the courts to try to keep those evictions from happening, but that's a separate pot. So this 3.5 is our first round. And as you say, you know, these CARES Act dollars, they're fluid to a point. I mean, remember, we have them designated 4 different buckets. Testing is one of them. PPE purchase is one of them. Rental assistance, small business programs. So we've got a lot of priorities here that we're trying to address. So this 3.5, we know will be a very good start in this space. If we need to do more and we've got some flexibility with those dollars in other buckets, we will certainly look at that. We have got some of that going on with the small business assistance program already, and so we will try to have that kind of flexibility with this program as well. But as far as the numbers, I will let one of the experts on the line answer that if they can, as to what you are seeing through your work at your agency with individuals who are facing this issue of not being able to pay their rent. So whether Jimmy, Kim, or Kurt would like to respond, I'll leave it to you.
Commissioner Dreihaus, I think one thing that needs to be pointed out as well is that the CARES Act dollars are being leveraged by other resources that both Talbert House, Community Action Agency, as well as Freestore has allocated to the rental assistance and utility assistance program. So these public dollars are having a leveraging effect and impact on the families that we're seeing. And right now, because of the eviction suspension, if you will, we have seen continued support needed by the families that we're serving. But we anticipate that as the evictions process gets ramped up again, we will be able to support more families, and that's really where we see the driving force of these dollars.
Thank you, Kurt.
Yeah, echo that. In a number of our programs, we know housing insecurity is a significant issue throughout the community. And as I understood the question, how will we get word out, or how will community members be made aware of this program? Through our normal channels of communicating with the clients and the public. I think there's a press release going out later today as well. But we're ready to serve and ready to kind of get these funds out. And as Kurt mentioned, leverage our resources to help clients in a much broader way.
Thank you. Bridget, the press release will have the contact information on it, obviously, from these organizations. So thank you for the question.
Our next question comes from Chris Wederick with the Business Courier. For you, Denise.
Hey, Chris.
Hey, good morning. What do you think the need is for this program at this point? Do you anticipate using all of it?
Yes. I think of it. I mean, it's hard because all of this is new. All of the funding that's coming down from the CARES Act, all of what it's going for is new. And so we learned from the small business assistance program some lessons. And so I do think there's a need. I wonder if we're going to need to allocate more dollars to this, but we think this is certainly a good start. 3.5 million is a lot of money. And that's part of the reason it's going to 3 different agencies, is because no one agency has the capacity to deal with 3.5 million. And remember, we're trying to get it out as quickly as possible and spend it by the end of the year. I mean, there are some provisions here from the federal government that we need to comply with. But if there's more need than what we've allocated, we're certainly willing to be as flexible as possible.
And then the other question I had is, do the tenants have to apply for this, or can landlords, could a landlord, for instance, apply on behalf of a number of his or her tenants that need this? So what does that look like from the regulation perspective?
Yeah, again, I'm going to leave this to the experts. Who would like to respond?
I'll respond. Yeah, the tenant has to make the application because they're the ones who are attesting and certifying and proving that they've had a loss of income related to the pandemic since the declaration of the public emergency. So it's all led by tenants, tenant initiated, although there is some information that we'll need to coordinate and verify from landlords, but it all is tenant driven.
Okay, thank you, guys.
Our next question comes from Larry Seward with WCPO News.
Hey, Larry.
Good morning, everybody. Given the federal pandemic unemployment assistance expiring in 2 days, you have people in public housing that could potentially face eviction. There's some people will look at this 3.5 million, 1,200 families potentially helped here, but that's it. Denise, from the perspective of anecdotally, all of the people hurting in this community facing eviction, is 3.5 million really all that we can do?
Well, I will have a chart for you next week to describe how the CARES Act dollars are being spent. So some of it, for instance, is being spent on small business assistance, which helps put money in the pockets of businesses that help keep people employed, that helps people not get into rental trouble. So some of what we're trying to do here is shore up in a couple of different ways. We know there are people that still need these dollars for rental assistance. And so we are trying to hit that mark. If we find that it is not adequate to address a much larger need, again, we'll relook at the program. And I will share with you, because the way these dollars have been distributed is not random. And so I will bring that to you because, for instance, this testing issue is a huge issue in order to get this under control and start to see things go back to what was the old normal. So we're putting $20 million towards testing. It's a huge amount of money, but we know health-wise that's what we need to do. So let me elaborate that at the next briefing. But again, if the 3.5 and the 1.5, remember, on the eviction side, so it's really 5 million, is woefully inadequate, we'll certainly adjust. We have adjusted already in some of these other categories, and we'll adjust on this one. I certainly think, though, it's a good start.
My next question is for the partners. I know, Jimmy, you mentioned 500 families that you're part of the program to help. Kim, how many families will yours help, and Kurt, yours as well? And how quickly do people need to get in line to actually receive it?
Okay, I'll start off, Larry, and thanks for your question. For Community Action Agency, we can help similar to Talbot House, about 500 families. And I would suggest that they start calling today. We are accepting applications. We'll send the information to them via, if they have email, we'll send it out via email. They can also, earlier I did not mention this, but if they're unable to get through our phone lines, they can contact us via email, and that is at epa@cincy-caa.org. And we can assist them that way as well.
As for the Freestore Foodbank, we will also serve 500 plus families as well with the dollars that have been awarded to the Freestore. When you couple that with the other assistance programs that we support, we're trying to bring overall stability through food, connection, and hope that we're bringing through this program and the support that's being offered. And as far as folks contacting us, you can reach out to Ryan Lucky today. I would encourage you to send him an email at rlucky@freestorefoodbank.org. I also put his the phone number in the chat box so that you'll have that information as well.
Thank you, everyone. That appears to conclude our questions from reporters.
Thank you. I do want to note that all of the work we're doing here is all interconnected. So are we allocating enough dollars to one thing or the other? Willing to have that conversation, obviously, try to roll these programs out as quickly as we can and learn from what people are telling us as they receive these dollars. But the idea here is to get the community back to businesses open, people moving around in a different way, right? I mean, we're going, I'm going out to restaurants like this, right? We're going out like this because this is what we need to do to make sure these businesses stay open. And so as businesses stay open, we need less support for some of this other stuff. And so we all need to do our part to make sure that the economy continues to slowly ramp up, communities, members remain safe, and we keep the death rates down. And so the stuff that we've been talking about for, I don't know, 3-4 months now, it seems like a million. Wash your hands, stay away from each other, and wear a mask. And then we don't have to have an increased allocation for something because people are unable to go back to work or in this community. And so I just want to remind people that there's a lot of connectivity to all of the work that Greg is doing, that the commission is doing. We're all in this together, partnering with the city, the other jurisdictions. We're all in this together, and we know what we need to do. So thank you again for doing your part. We're getting there. We're not there yet, but we're getting there. So thanks again, and don't forget to wear your red on Friday. Thank you.